One of the things that you talk about is energy medicine. Can you just explain what that is exactly?
Well, energy medicine is an ancient way of tapping into the wisdom of nature, of using, often the Greeks, Hippocrates would say, it is the energy that flows from your hands. And hands-on healing was big back then. Even the scriptures tell us that Jesus touched the sick, and he said, you know, it wasn't me who touched you, but it was your belief that healed you. So it's touch, it is vibration, looking at people in a different way, from a different perspective, looking at their overall well-being rather than just zooming in into blood tests, saliva, urine tests. That's zooming in. Energy medicine sort of helps us to zoom out. And you know, there's Reiki, there's massage, there's Ayurvedic medicine with the breathing. I mean, that is also energy. Thought is energy. Yoga, meditation. You have traditional Chinese medicine that would use energy pathways to help unblock and regulate the pathways of fluids and energy. So you would use acupuncture needles on specific meridian grids. It's thousands of years old. I mean, so this is, I think, very essential to go back to our roots, to connect back and using those earthly methods, and also touching people, looking at them, listening to what they have to say, having more time with them.
And what you do kind of ties in with that. Can you discuss the ONDAMED treatment modality and exactly what you do with that?
Yeah, ONDAMED fits really into any practice. So I have a practice in Germany, and what you do is what is so brilliant about the ONDAMED technology is that with the help of the patient being the compass, us using their autonomic nervous system, we palpate at the radio pulse while stimulating them with focused electromagnetic fields through specialized applicators. So almost like a tricorder on Star Trek, when Beverly Crusher goes along the body, and that is 21st century, so it's already a little smaller and more automated. But we touch the patient's radio pulse, and whenever we find a disturbance, an electromagnetic disturbance, then the patient's radio pulse intensity becomes stronger. So it's not heart rhythm, it is an autonomic nervous system response, and just gives you a stronger sensation of the volume, of the amplitude of the pulse. And when we come across such a region on the body, that would stand for possible inflammation, infectious processes, traumatized tissue, and scars, and very profoundly even unresolved emotional trauma or shock that's residing on a cellular level. And we all have those. But where are they stored? I mean, we're like semiconductors, crystals, storing all the information, walking through life. So here I have a non-invasive way, touching the patient, letting the patient be in the driver's seat, directing the practitioner of where to stimulate, and then also it answers the question, well, what frequency or frequency combination is most significant for the patient at this time. So I can answer the question of where are the problems in the body and what stimulation is the most significant, most therapeutic one for that individual at that time.